So there's different ways that we can experience a flashback, and some of these might be familiar to you as I describe them to you. So first, if we think about when we're not in a flashback, when we feel calm, safe enough, in an okay environment, and we are able to interact with other people, that's often what we call social engagement. So that's what I refer to as regulated relatedness. We're related to other people in a way that feels calm and regulated for our nervous system. However, when we are experiencing more symptoms because of CPTSD and we're perhaps in a flashback, one of the things we can experience is called the fawn response, or please and appease. And so on the surface, it might look like that social engagement or regulated relatedness, but what the outside world doesn't realize is that inside we might be feeling a lot of fear and uncertainty. And so the sense is, I'm being nice to you because I'm afraid of what will happen otherwise. So that's really that please and appease response. And that might show up in a variety of ways. So that might show up as being overly nice or ingratiating to other people in an indiscriminate way. So regardless of who they are or how long you've known them, you feel like you have to be overly nice or deferential. It might show up as avoiding expressing any kind of negative feelings for fear that it will push or scare other people away. Ignoring or discounting red flags in other people, so relying on niceness and kindness with people who are actually not safe or deserving of our kindness. And sometimes this is referred to as self-gaslighting. Another way this can show up is by ignoring or discounting the red flags that we see in other people. So our body's telling us something's wrong, but we override it with niceness. Sometimes that's referred to as self-gaslighting, or talking ourselves out of what we actually know about a situation. In a more ongoing or sustained way, if we're actually in an ongoing relationship with someone, sometimes you can see a more exaggerated fawn or please and appease response. And sometimes this is described in terms of the term codependence. Now, people have different feelings and opinions about that word, but it just speaks to the sense of that if you're in a sustained relationship and there's an ongoing feeling of fear or uncertainty, that you might always default to please and appease or being nice as a way to stay safe. So if we are somebody who ends up using please and appease or fawn a lot, there may still be times that that doesn't work for us, and so we might need to use another response. And so one of the ones that you've probably heard of most commonly is fight or flight, and those are two different responses. So if we are somebody who finds ourselves spending time in a fight response under severe stress, that can show up in a few different ways. So we might see fight in terms of needing to control things, having to have everything managed, might be controlling ourselves as well as controlling other people. It might show up in terms of needing to predict things ahead of time, to obsessively plan every detail and always be in control of the situation. Fight can also show up in terms of always being on guard and expecting the worst in people, assuming the worst possible interpretation of people's thoughts, words, behaviors, and then acting accordingly. And then, of course, on an extreme level, fight can mean that we might actually get into some verbal or physical altercation with someone. Conversely, if we're somebody who spends a lot of time in a flight response, there's a sense that we're literally wanting to flee or run away from whatever's causing us fear. And that can manifest outwardly or internally. So if you're somebody who has a lot of flight response, you might literally leave in the middle of a conflict, like actually want to leave the house or run away in the middle of a conflict. It could be, quitting a job because you don't feel safe, leaving a relationship, moving to a different location. Another thing that I hear about quite often that's a more subtle form of a flight response is to ghost people. Like you hear about, being ghosted on social media or not responding to people's text messages or phone calls. So that can be a flight response. It's really anything that involves us mentally running away, or an example might be getting lost in endless social media scrolling, what we sometimes call doom scrolling. On a subtler level, a flight response can show up as a way of abandoning ourselves. Like if you're with someone and they don't feel safe, and maybe you have to please and appease, but also there's a sense that you're leaving yourself to keep that person happy. So you're fleeing from yourself, so you're actually abandoning yourself in the process. Because you can see this in somebody who really takes too much responsibility for other people or excessive caretaking for other people. So you're fleeing your own inner experience to take care of somebody else on the outside. And on a more extreme level, that can show up as dissociation. So dissociation is that sense that we kind of go away in our mind and we're not fully present to our own experience. Now, a freeze response is interesting because I often explain this to people I work with as like having the gas and the brakes on at the same time. So there's a sense of paralysis, but there's a lot of activation in there. So part of us wants to run away, and part of us also feels stuck at the same time and not sure where we're supposed to be going or what we're supposed to be doing. Sometimes a freeze can have an overt feeling of fear attached to it. You know, for example, a fear of moving forward in life in case we make the wrong decision. And sometimes we can end up in decision paralysis, like not sure where to move forward. And then again, on an extreme level, that can show up as dissociation. It can also look like procrastination. So if you're somebody who thinks you might have ADHD or have been diagnosed with ADHD, procrastination we talk about as one of those main symptoms where we kind of avoid doing something because there's this underlying fear we might get it wrong or we might mess it up or we don't know how to ask for help. So that can be a bit of a freeze response when we procrastinate. And that can often go along with perfectionism. Like there's a sense I have to do this thing perfectly or I can't move forward. So if you're somebody who grew up with a lot of perfectionism put on you, then you might be apt to use a freeze response. And a freeze response can also happen if we're in a very new or unfamiliar situation and we have a hard time trying to problem solve and move forward. Now, the collapse response in a way is maybe the most extreme nervous system response. And what's interesting is when I first started to work with complex trauma survivors, I actually met a lot of people who were in a collapse response, and how that shows up might be severe and debilitating fatigue, what we sometimes refer to as treatment-resistant depression. And really what goes under that is this really intense feeling of maybe helplessness, hopelessness. It doesn't matter what I do in the world, things don't seem to work out, so I just kind of give up. And so it's like our whole nervous system kind of shuts down and collapses in on itself. So I know when I've talked to survivors before, they're often surprised to learn about the collapse response because they start to recognize it in themselves and think, oh, I thought that was just a freeze response. But the collapse is really your whole arousal system comes down, and there really is that physical sense of collapse. Like you might spend a lot of time in bed not able to really get up and do a lot. The other time where you can see collapse, if you're somebody who stays in a high arousal state all the time, like a fight or flight, or sometimes a freeze, our nervous system can't maintain that indefinitely. At some point it's going to wear out, and so sometimes people will crash from a high arousal state like fight or flight into a collapse response. So there's a couple of important points I want to make about these nervous system responses. They're not usually voluntary, they're automatic. Our body is kicking into survival mode, and it's our autonomic nervous system or automatic nervous system that does these things. So don't feel bad if you identify with one or more of these responses, because it's just your body doing what it knows how to do to keep you alive and help you survive. So these responses are usually not voluntary, they're hardwired into us, and in fact all people have them. It's just that we tend to experience them more if we've had a history of complex trauma. Along with that, when you take a more medical model approach, somebody would tend to look at these responses and see them as symptoms or problems to be fixed. However, myself as a trauma therapist and spending a lot of time with survivors, I think it's a lot more helpful to look at these nervous system responses as adaptations to adversity. So I always like to use a quote from Viktor Frankl: an abnormal reaction to an abnormal situation is normal behavior. So the fact that we have these nervous system responses was actually what kept us alive during the trauma. So the response itself is not a sign of a problem, it's an adaptation, it's actually a sense of our resilience. However, if we find ourselves now in a more safe situation, like we're not currently experiencing any kind of abuse or trauma, we might still go automatically to those nervous system responses even when they're not that helpful anymore. And even if we get through the immediate situation, they might cause secondary problems for us that we weren't really intending. So really the whole purpose of trauma recovery generally is to notice when we're inclined to engage in these responses and then look at ways to creatively do something different.